This is new territory for the Congolese. They know Ebola, but not like this.
Well, the disease starts as a fairly mild infection, like many virus diseases, with joint pains, a fever, headache, but it soon becomes a very much more severe illness.
Dr. Simpson was sent from London to investigate the outbreak of a mysterious disease in Zaire, as it was then known, in 1976.
There are about 600 deaths. Of course, there's danger, but we should be taking as many precautions as possible.
In 1995, there was another outbreak, and like 1976, it had a fatality rate of over 80%. If those two strains were siblings, this one is more like a cousin, because its fatality rate of 30 to 40% means more patients survive. So more people spread the virus, making it the fastest growing Ebola outbreak in history. But the man in charge of fighting the Ebola outbreak is confident they can stop the spread if they get the tools they need.
If you have the necessary resources, I think it will be possible to do that. Because I can tell you confidently, there are some areas where we were having really hard time about 6 or 7 weeks ago. I can tell you today that we are not facing this tension. We are seeing a kind of stabilization of the situation where we are capable of intervening as quick as possible. The other element also is about the scale up of the surveillance capacities, detecting cases as quick as possible, looking at the scale and also the geographic expansion of these outbreaks, what all it requires, the distances, the need of cars, ambulances, and all of these elements. It's clearly, need more funding capacities.
But it's not just more money. The World Health Organization also needs help from the Congolese.
Yesterday, one of our ambulances was attacked here. One of the ambulance of the response operation was attacked here, in Bunia. And we are really extremely, very regularly challenged by the daily basis. We face some kind of reaction, from the communities. And again, these are difficult situations. People are having their relatives who are sick, who are dying. This is for the good of themselves, the good of their family.
Over 11,000 people died in the world's biggest outbreak, which hit multiple countries in West Africa 10 years ago. That's 9,000 more than the current outbreak. But with no vaccine to stop the fastest spreading strain of Ebola ever, and the world's biggest health agency pleading for more resources, few would bet against this outbreak surpassing that one. Paul Hawkins, TRT World.